Hello, and welcome to the What's New to Medicare 2021 presentation brought to you by the Michigan Medicare Medicaid Assistance Program, also known as MAP. My name is Melissa Devine, and I am the site coordinator for Livingston, Washtenaw, and Monroe counties. Today, we're going to learn what's new to Medicare for 2021. First, let's learn what Medicare is. Medicare is made up of 4 parts. Part A, which is the hospital insurance. It provides inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Part B is the medical insurance, and it provides coverage for services from doctors, outpatient care, home health care, DME, which is durable medical equipment, and preventative services. Then there's Part D, prescription drug coverage. This provides insurance for your prescription medications and some vaccines. And the fourth part is Medicare's Part C, Medicare Advantage. This is a bundle of A, B, and D in one plan. They are HMO and PPO plan options, and they may offer extra benefits. When you first enroll in Medicare and during certain times of the year, you can choose how you get your Medicare coverage. There are 2 main ways to get Medicare. First is with Original Medicare, which includes Part A and Part B, and you can add a Part D plan to help pay your out-of-pocket costs. You can also shop for and buy a supplemental Medigap plan. With Original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the U.S. The second way to get Medicare is through Medicare Advantage, also known as Part C. Medicare Advantage, again, is all-in-one alternative to Original Medicare. These are the bundled plans that include Part A, Part B, and usually Part D. These plans may have some lower out-of-pocket costs than Original Medicare, but in many cases, you will need to use the doctors who are in the plan's network. Most plans offer extra benefits that Original Medicare doesn't, like vision, dental, hearing, and more. Now let's move on to look at the Original Medicare updates. The Medicare Part A deductible that beneficiaries pay when admitted to the hospital is $1,408 for the year 2020. The Part A deductible covers the beneficiaries' share of costs for the first 60 days of Medicare-covered inpatient hospital care in a benefit period. Beneficiaries must pay an additional $352 per day for days 61 through 90 in 2020, and $704 per day for hospital stays beyond the 90th day. For beneficiaries in skilled nursing facilities, the daily coinsurance for days 21 through 100 in a benefit period is $106 in 2020. For the small number of beneficiaries who pay Medicare Part A monthly premiums, their monthly bill can be up to $458 in 2020. Medicare Part A covers inpatient hospital, skilled nursing facility, and some home health care services. Although about 99% of Medicare beneficiaries do not pay a Part A premium, because they have at least 40 quarters of Medicare-covered employment, enrollees age 65 and over, and certain persons with disabilities who have fewer than 30 quarters of coverage may pay the monthly premium in order to receive their coverage under Part A. For Part B, the monthly premium is at $144.60 for 2020, with an annual deductible of $198 for 2020. More information is to come for 2021's Part A and Part B costs in December. They release the Part A and Part B costs when they release any COLA information for those that are getting Social Security benefits. Remember, Medicare fraud and abuse is always present, whether through phone, mail, billing, etc. There are some current scams to be aware of, and those can include COVID-19 contact tracing, COVID-19 testing, and COVID-19 marketing of vaccines. You should not ever give your information out over the phone, including bank accounts, credit card numbers, social security numbers, and more. If you don't know who's calling or sending you messages, you don't have to respond. And always report incidences like this to MAP at 1-800-803-7174. If a beneficiary chooses to delay enrollment in Medicare Part A, Medicare Part A will retroactive 6 months, requiring that the beneficiary stops contributions to their HSA account 6 months prior to signing up for Medicare. There are tax implications if this is not followed. Now let's take a look at the Medigap updates. The Michigan Medigap Subsidy. It is currently still available. To qualify, you must be a Michigan resident with a household income no more than $28,710 per year if you are single, and no more than $38,790 per year if married. The supplemental plans that are covered with this Medigap subsidy are through AARP United Healthcare, Blue Cross Blue Shield of Michigan, Blue Care Network, McLaren Health, and Priority Health. The Michigan Health Endowment Fund created this subsidy to help Medicare beneficiaries pay for their monthly Medicare supplement or Medigap insurance premium. The subsidy amount received depends on the beneficiary's age. For those under 65 with a disability, the Michigan Health Endowment Fund will help pay $75. For those 65 to 74, the Michigan Health Endowment Fund will help by paying $25. And for those 75 years and older, the Michigan Health Endowment Fund will help by paying $45. This help is a monthly premium subsidy. So how do you apply? First, you can apply online through MichiganMedigapSubsidy.com. You can call MHEF at their 800 number, Monday through Friday, 8 a.m. to 6 p.m., and the call is free. Or you can fill out and send in a paper application. Please note that the Michigan Medigap subsidy is guaranteed to run through to the end of 2022. However, there are no new applications accepted after January 2021. If you need more assistance with the Michigan Medigap subsidy, call MAP at 1-800-803-7174. Effective January 1st, 2020, any beneficiaries who are new to Medicare, meaning they have aged into Medicare and turned 65 on or after January 1st of 2020, are not able to purchase Medigap plans C or F. There are plan alternatives to C and F, and those are D, and G. Those currently enrolled with Medigap plans C and F can keep their plans. For more unbiased information on Medigap plan options, give MAP a call. Now let's look at the Medicare prescription drug benefit updates. If you do not have creditable coverage and do not enroll in Part D, then you must pay a late enrollment penalty. The penalty is added into your monthly premium. You will continue to have the penalty for the entire time that you have Part D coverage. The Part D late enrollment penalty is calculated as 1% of the Part D base beneficiary premium, which is $33.06 in 2021. This is for each month that a beneficiary did not have creditable coverage and is not enrolled in Part D. This penalty amount does change each year as the Part D base beneficiary premium changes each year. Part D premiums are subject to income adjustments, just like Part B premiums are. This is referred to as the Part D IRMAA, or Income-Related Medicare Adjustment Amount. Beneficiaries with significant income will pay a sliding scale higher Part D premium based on the IRS tax returns from 2 years prior. For 2021 IRMAA amounts, Social Security will be looking at IRS tax returns from 2019. There are 6 income categories, and each category has a set dollar amount associated with it. For more information on Part D IRMAA, give MAP a call. This is the 2021 Standard Medicare Part D Basic Benefit Structure. Each month, the beneficiary will have a monthly premium to pay for their Medicare Part D plan. There are many plans available, some of which have a $0 deductible, but majority have the deductible of up to $445 annually. During that time, the beneficiary is expected to pay the bulk of their cost of the medications until they reach their deductible amount. Once reaching the deductible amount, the beneficiary will then be responsible to pay up to 25% of the cost of their medications. Each plan does have its own specific contractual agreement amount and tiers for medications that will change copayments or coinsurances. After the beneficiary has billed the insurance for $4,130, you enter into the coverage gap, where the beneficiary is responsible for 25% of the cost for their generic and brand medications. Once the beneficiary has either paid $6,550 out of pocket for their medications for the year, or the insurance has been billed $10,048.39 for the retail cost of medications, the beneficiary can then enter into the catastrophic coverage, where they're only responsible for 5% of the medication costs. In 2021, beneficiaries who reach their coverage gap or donut hole will pay a maximum of 25% for their generic and brand name medications. There are subsidies available to help pay your Part D premiums, deductibles, and copays. This is referred to as the Low Income Subsidy or Extra Help Benefit. It is provided by the Social Security Administration, and the guidelines change each year. In March, effective April. Any changes we have for 2021 will be provided March 2021 and effective April 2021. Contact MAP for further information and assistance with the LIS Extra Help benefit. The MMA does not allow continuous open enrollment for Medicare's Part D drug benefits. Most beneficiaries have limited timeframes to enroll, disenroll, or switch their Part D plans. There are 3 enrollment period categories: initial enrollment period, annual enrollment period, and special enrollment periods. The annual enrollment period, often known as open enrollment period, is October 15th through December 7th each year. Any changes or enrollments made during this time will be effective for January 1 the following year. So any changes that you may make to your Medicare Part D coverage or Medicare Advantage plans in October through December will be effective January 1, 2021. Special enrollment periods enable beneficiaries to make Part D plan changes in special situations. This can include involuntary loss of creditable coverage, moving, and other exceptional circumstances. Beneficiaries who qualify for Medicaid or the LIS Extra Help benefit have a special enrollment period that allows them to join or switch plans once per calendar quarter. There's also a special enrollment period for low-performing plans. This will be a letter sent to you from Medicare if you are in a low-performing plan. People who are enrolled in either a Part D plan with less than a 3-star quality rating or a Medicare Advantage plan with less than 3-star quality rating will be given a special enrollment period. During the special enrollment period, you can switch into a plan that has either a 4 or 5-star rating. Medicare, often referred to as CMS, will send a letter to the beneficiary who's enrolled in the low-performing plan to notify them of the special enrollment period. Plans who have received less than 3-star quality rating for 3 consecutive years are considered low-performing plans. Beneficiaries are not able to enroll in these low-performing plans on Medicare's website. You can enroll directly through the plan, and if you're viewing it on the Medicare Plan Finder website at medicare.gov, you will see a warning symbol on Medicare's website underneath the plan. It'll look similar to the one on the bottom of this screen. Medicare's Plan Finder is used to help you either do an anonymous search, which will not save your medication list if you need a second counseling session. It will allow you to create a login or a mymedicare.gov, and having that created login provides personalized search options, saves your medication list if you need a follow-up counseling appointment, and allows you to do more with your Medicare, including viewing your MSNs, your Medicare summary notices, and even paying your Part B premiums online. With Medicare's Plan Finder, you can compare Part D plans and Medicare Advantage plans, viewing the cost of your medication list with those plans, any deductible pricing, and monthly premium pricing. For more information, call MAP for a personalized counseling session. All plans provide an annual notice of change each year. Part D and Medicare Advantage plans can change their benefits and costs annually, so be sure to check your annual notice of change for any premium, deductible, or copay changes for the following year. make sure that your drugs are still covered, and if they're still covered, that they are still on the same tier, and if there's any restrictions to your medications. Could there be another plan that offers better coverage for you? Using Medicare.gov's Plan Finder will help make that determination. Just remember, plans cannot change their coverage mid-year, so you'll receive your annual plan changes or annual notice of change in September and October for any plan changes coming the following year. 2021's Medicare and U-Book has a few new pieces of information. You have the Part D Senior Savings Model, which is a program from Medicare that helps lower the out-of-pocket costs on certain insulin medications. The Senior Savings Model is not available to beneficiaries who are receiving LIS Extra Help, but there are companies that will offer this assistance. For more information on the Senior Savings Model, you can view that on page 84 in the 2021 Medicare and U-Book, and reach out to MAP for more information. For beneficiaries with ESRD or end-stage renal disease, there's now coverage through Medicare Advantage plans. For more information, see page 59 in the 2021 Medicare and U-Book. Acupuncture is also now a covered service for Medicare. Medicare will provide coverage for acupuncture for chronic lower back pain up to 12 visits in a 90-day period for chronic low back pain. See page 30 in the 2021 Medicare and U-Book. And as always, for more information, give MAP a call. Some things that you should consider during Part D plan enrollments. Consider the cost. What are the premiums, deductibles, the copays? Does that plan offer a Part D senior savings model? What's the coverage like? Are all of my meds covered? What tier are my meds covered at? Will I need prior authorization, quantity limits, step therapies? Is there nationwide coverage? Also, which pharmacy is in-network and or standard or preferred? Is there a mail order option? For 2021, we have had some changes to your Part D offerings. There are now only 29 Part D plans, which has gone down from 2020. There are 18 plans that are enhanced, which means they offer more benefits than a basic plan. There are 11 basic plans. There are 4 plans with a $0 annual deductible. And of those 4 plans, the lowest premium $0 annual deductible plan is at Silver Scripts. It is the Silver Script Plus plan, running $65.10 per month in monthly premium. And there are 9 plans with premiums less than $25. The lowest Part D premium is Silver Script Smart RX, running $6.90 per month. The highest Part D premium plan is Prescription Blue Premium, running $109.30. The average Part D monthly premium is $38.57. There are 3 plans that offer assistance with gap coverage, and the lowest cost plan with gap coverage is through Cigna Secure Extra RX, running $39 per month. The providers for Part D plans that offer nationwide coverage include Aetna Medicare, Cigna, Elixir Insurance, Express Scripts Medicare, Humana, United Healthcare, and WellCare. Medicare Advantage plans in 2021. There are many options with the lowest premium of $0 per month. Those companies include Aetna, Blue Care Network Advantage, Blue Cross Blue Shield, HAP Senior Plus, Humana Choice, Paramount Elite, Priority Health, Reliance Medicare, United Healthcare, WellCare, and Zing. The highest monthly premium for a Medicare Advantage plan is $299 per month. This is through Medicare Plus Blue PPO Assure. The number of Medicare Advantage plans offered in each county for our region are 43 in Livingston County, 47 in Macomb County, 44 in Monroe County, 54 in Oakland County, 37 in St. Clair County, and 42 in Washtenaw County. Medicare Advantage plans oftentimes offer extra benefits. Those include dental, vision, and hearing benefits. If you decide to switch your Medicare Advantage plan and have a dental, vision, or hearing benefit, they are typically a separate insurance rider that you purchase. So if you make a change to a different company, be sure to call the prior company that you have that rider with and either change that rider or see if you can keep it with a different plan. Some other extra benefits offered through Medicare Advantage include fitness benefits, transportation, telehealth, and more. There are marketing guidelines for Part D plans. Part D plans cannot market themselves as Medicare endorsed, solicit from door to door, call people on the national and state do not call list, enroll people over the phone during a solicitation call, offer incentives or gifts that exceed $15 in value, market outside the plan's service area, engage in activities to mislead or confuse beneficiaries, or conduct sales presentations to collect enrollment applications at health fairs. October 1st has already passed, but October 1st is when the 2021 Part D and Medicare Advantage plan information became available on Medicare.gov. Also, plans can begin marketing then, so check your mailbox if you start to get marketing information. Your annual notice of change should have also been sent to you by your current plan provider for their changes for the following year. Medicare and You 2021 books had also began being sent. October 10th is some star quality ratings released on Medicare.gov, which is the Medicare Plan Finder. October 15th through December 7th is your open enrollment period, and January 1st is when your plan becomes effective. How to enroll in a plan. You can always call MAP at 1-800-803-7174 for an unbiased look at plan options available to you. You can also enroll online through Medicare.gov, enroll online at the plan's website, contact the company of your choice to request an application packet, or call 1-800-MEDICARE for assistance in enrolling over the phone. For more information, you can always visit Medicare.gov's website, read the Medicare and You handbook, call 1-800-MEDICARE, and of course, give MAP a call at 1-800-803-7174 for unbiased educational information helping you navigate the maze of Medicare. If you have any questions, please feel free to reach out to me. you can give me a call at 1-800-803-7174. You can also send me an email at mdevine@aaa1b.org. That's MDEVINE at AAA1b.org. Thank you so much for joining me today, and have a wonderful day.